Welcome to the College of American Pathologists Foundation C-Test and Treat webinar, What It Takes to Host a C-Test and Treat Program, Logistics, Planning, and Funding. C-Test and Treat is a CAP Foundation initiative that delivers free, pathologist-led cervical and breast cancer screening to vulnerable women in U.S. communities. The goal of C-Test and Treat is to engage underserved patients in community health care services by offering same-day screening, results, education, and immediate access to follow-up care in a culturally appropriate setting. In addition to fulfilling unmet healthcare needs, C-Test and Treat aims to engage women and their families in routine preventative healthcare behaviors by connecting them with a regular healthcare provider. Hello, this is Julia Rankenberg, and I am the CAP Foundation Program Development Manager. This webinar is designed for pathologist leads, physician leads, and program coordinators who are either interested in hosting a C-Test and Treat program or who have already made the decision to host a program. During this webinar, you will gain an in-depth sense of how a program operates, when to start your planning, development of program workflows, important deadlines, and helpful resources that are available to you through the CAP Foundation. Takeaways from today's webinar are to learn about the core components of C-Test and Treat, navigate the planning process, understand the grant application process. In the U.S., a woman is diagnosed with cervical cancer every 40 minutes. That's 12,000 new cases of cervical cancer yearly. 1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime. Our core conviction is that no woman in America should die from undiagnosed cervical or breast cancer. Cervical cancer is preventable, and breast cancer can be treated when it is diagnosed early. Whether due to health literacy, finances, logistics, or language, far too many people in America's underserved communities live without regular preventative care. C-Test and Treat gives thousands of participants, both women and the family and friends they bring with them, the experience of overcoming their barriers to healthcare, connecting face-to-face with friendly providers, and learning how to schedule important care. It also connects hospitals, clinics, clinicians, and volunteers with the communities they serve. In a single day, culturally appropriate program, women receive a pelvic and clinical breast exam, a Pap test with same-day results, a screening mammogram with same-day or prompt results, connection to follow-up care plans, interpretive services, translated educational sessions and materials, and a healthy meal. C-Test and Treat provides an in-person collaborative experience and further strengthens relationships amongst team members across all levels of an organization. From security to the C-suite, everyone plays a role in C-Test and Treat. Each program is unique in terms of the audience it serves. For this reason, volunteer team sizes vary from upwards of 50 volunteers to 80 volunteers. Everyone here is part of a team. We are helping to break cycles and to improve health literacy. No more, I didn't go to the doctor because my mom did not go unless she was sick. As you can imagine, it takes a team of clinicians and volunteers to deliver a C-Test and Treat program. To support C-Test and Treat program screening goals, services, logistics and flow, educational activities, and overall patient opportunities, determining how many volunteers you will need is a crucial step. The Standard Operating Procedure Manual contains more information on volunteer teams, along with providing a work plan to help guide the team through the planning process. Your first step is to talk with your hospital or clinic administration to gain support in bringing a C-Test and Treat program to your facility. Be prepared to discuss the need and resulting impact on your community in offering these life-saving screening services to women facing barriers to care. It is recommended that all See, Test, and Treat programs identify a program coordinator to assist with planning and coordination activities, such as planning group meetings, taking meeting minutes, and coordination of follow-up assignments. Ideally, this person has project management skills. Some ideas for a program coordinator include a part-time nurse who can take on a project requiring a few additional hours each week, or a graduate student, someone in an administrative fellow program, or a retired member of the healthcare team who is looking for a part-time temporary assignment. Reach out to contacts in these areas to talk about See, Test, and Treat, the program goals, the resulting community impact, and how their support is needed to make the program a success. Be prepared to answer the question, what do you want or need from me and my team? Once you have your planning team assembled, establish a regular day and time for your group meetings. Keep the lines of communication open. One way to do this is to provide a summary of all meeting discussions along with follow-up assignments in advance of the next meeting. We suggest that new programs start the planning process at least 10 months in advance, meeting monthly and then more frequently as you get closer to your See, Test, and Treat program date. See the Standard Operating Procedure Manual for a suggested work plan and meeting schedule. The core of the See, Test, and Treat program has 4 immediate goals: screening, same-day results, education, and connection to care. The long-term goals of the program are saving women's lives from preventable cancers by engaging the patient and her family in their personal health care, empowering families through preventative health care by getting them enrolled, established as a clinic patient, along with participating in a clinic for ongoing care, connecting communities with healthcare providers by promoting partnerships and collaboration between the healthcare team alongside patient engagement. See, Test, and Treat programs are typically a one-day annual event, many times on a Saturday, reaching between 50 and 100 women and their families. That's large enough to deliver real impact and efficiency, yet small enough to ensure a dignified experience, which is an important thing for a group of women who may not have had a lot of positive experiences with our healthcare system. Every See, Test, and Treat takes place in a healthcare setting, typically a hospital or clinic, providing Pap tests and screening mammograms with same-day results and education. Women with abnormal screening results schedule their next appointments on the same day. Some programs have the ability to do some additional testing on the day of the event. That would include additional cervical procedures such as colposcopy and LEAP, FNA, ultrasounds for suspicious breast lumps, and additional diagnostic mammogram views. This one-day approach effectively addresses barriers encountered by uninsured women faced with health disparities, those who have little or no access to preventative care, and also provides a medical home for the future. For those facilities that cannot process and screen Pap tests on site, the use of a nearby lab has proven successful. Pap specimens are couriered throughout the day to the processing site. Paps are processed in batches with the results sent to the host site, clinic or hospital, via a secured electronic transmission throughout the day. For those facilities that do not have on-site mammography, use of a mobile mammography van or equipment and mammography techs have been brought to facilities for use during the program. Foundation resources are available to help program sites identify solutions for challenges they face during program planning. Because of the diverse nature of the target audiences that See, Test, and Treat serves, programs may need to support multiple languages in their recruitment efforts and during their one-day program. Use of community partners and interpreter staff has proven to be very successful in reaching, communicating, and engaging your target audience to register for your See, Test, and Treat program. Some sites conduct pre-program workshops to explain what C-Test and Treat is about. They demonstrate how exams are conducted to calm fears of those who face language, cultural, and health literacy barriers. This allows the women and their family members an opportunity to gain a better understanding and ask questions of the presenters in their native language. Cervical and breast cancer screenings are the core of C-Test and Treat, but they're also just the beginning. While waiting for their test results, the program uses this opportunity to educate women on the importance of preventative screening, healthy lifestyles, and nutrition in a safe, caring, festive environment. Every program is tailored to include additional health services that respond to the unique needs of its community. These can include healthy cooking and nutrition classes, blood pressure and blood sugar testing, exercise classes, and healthy living education. The programs also include a health fair where community partners share valuable resources with patients and their families. Health fairs can include information on dental health, home safety, job placement resources, basic financial information, healthy limit, cancer resources, and support groups. Program participants spend an entire day focusing on their health and well-being and connecting with resources in their community. C-Test and Treat provides translated, culturally appropriate education to teach women and their companions about breast and cervical health, healthy lifestyle behaviors, and nutrition, as well as the value of routine preventative care. At the majority of programs, pathologists connect a screen to their microscope, and at other programs, a pathologist or resident volunteer sits at a dual-headed microscope and engages patients in what healthy versus unhealthy cells look like. The CAP Foundation has developed patient education kits made up of 3 components. A patient activity guide. This handout provides information to patients on the importance of cervical and breast screening, along with leading a healthy lifestyle. A PowerPoint presentation. This patient education tool is intended to explain and reinforce the information contained in the patient activity guide. An educator guide. This document provides ideas and suggestions on how to implement and use these educational materials during your C-Test and Treat program. Through C-Test and Treat, women better understand their own health care and how to ask questions of their providers. Each woman receives her test results that day from a medical professional. This unique dialogue turns the scariest part of healthcare, waiting for results from a potentially life-changing test, into one of the most welcoming, supportive, and educational. The CAP Foundation provides support and direction to individuals and organizations involved in the planning and execution of a C-Test and Treat program through many channels. The program's standard operating procedure manual provides a baseline standard for planning, execution, and follow-up that applies to any C-Test and Treat program. Ensures a consistent, quality experience for patients, clinicians, volunteers, healthcare systems, and the community. Offers guidance and approaches to ensure repeatable and scalable programs. Additionally, myself and our Director of Programs are available for project management support. As previously stated, the Foundation provides professionally developed patient education materials to ensure consistent education for all participants. This education kit comes complete with an educator guide that provides step-by-step instructions for implementing the education content into your program. Our Communities of Practice offers program organizers and coordinators an opportunity to network with other program leads and coordinators, discuss and hear how other programs have faced program challenges and best practices for how to enhance or improve programs. We offer funding. CAP members interested in hosting a C-Test and Treat program are eligible to apply for grant funding up to $20,000. And lastly, The CAP Foundation provides See, Test, and Treat t-shirts to all volunteers, along with creating personalized certificates of appreciation for everyone involved in the program. Planning is the key to any successful event. For See, Test, and Treat, the overall planning process includes identifying a medically at-risk population that faces barriers to care and that could utilize a program like See, Test, and Treat, gaining commitment from a host site, thinking about your screening goals. The minimum program threshold is 50 women, suitable for a half-day program, and the recommended maximum is 100 women, ideal for a full-day program. And thinking about your planning team, approach team members now to pitch See, Test, and Treat and gain their support. We have had many successful programs managed by non-physician, non-clinicians who have great project management skills. As your program planning begins, items to discuss with the group include program flows and logistics, such as how will patients register for your program? How will they receive the screenings and be connected to follow-up care? How will you manage the specimens and results? What volunteers are needed? What other activities will take place during the program? What type of marketing and communication initiatives and tactics will your program employ? Engage your marketing, communications, public relations staff early in the program planning process. Consider how your program will be promoted to reach your target audience. What are the best channels to use within your community, and which community partners can assist with outreach? Develop a system to screen and register eligible women for your program. It is important to train staff taking calls and consider patient language needs. It is important to make sure that all members of your team are comfortable with all aspects of your See, Test, and Treat program. You can conduct one or more on-site program walkthroughs with the planning team, hold an informational session 1 to 2 days before your program with all volunteers to orient them to the on-site program, their role, and any general volunteer guidelines. Another recommendation is to host an open house the night before the event for all community partners, volunteers, hospital administrators, as well as your C-suite. Provide refreshments and conduct a walkthrough of the next day's program, allowing for discussion, Q&A, and networking. After your See, Test, and Treat program, it's important to conduct a debrief session with volunteers to gain input and determine what changes need to be made to your program for the next year. Celebrate. Host a thank you lunch soon after the event and invite hospital administrators, C-suite, and volunteers, recognizing crucial members of your planning team and volunteers in a number of different ways, internally on message boards or electronic means, newsletters, your intranet, institution website, or press releases. You can additionally leverage internal awards available within your institution for See, Test, and Treat volunteers. In other words, thank people for their valuable time and support. See, Test, and Treat is supported by donations to the CAP Foundation. To help us support and expand our reach across the U.S., we look to host sites to help identify area companies and foundations that can be approached for local funding. On average, See, Test, and Treat sites commit anywhere between $40,000 to $50,000 in support after total program costs are tallied. This would include grant funding plus the dollar value of volunteer time and additional services not covered by the grant. We ask all teams to please share ideas with us as you plan your See, Test, and Treat program. As See, Test, and Treat continues to demonstrate its impact on communities across the United States, we are experiencing an overwhelming response from others to host programs in their communities. To take this life-saving program to the next level, the CAP Foundation has established an 18-month program pipeline. This pipeline is an aid to host sites as well as foundation operations, ensuring advanced planning, budgeting, and fundraising. all vital areas needed to help C-Test and Treat achieve greater scale and impact. Our program process begins with our request for applications, our RFA, which runs June 1st through July 31st for programs targeting delivery in the following year. With this in mind, now is the time to work within your organization to gain support to host a program and recruit colleagues to support you in this life-saving endeavor, because no woman in America should die from undiagnosed cervical or breast cancer. All sites, both new and repeat, wanting to host a program and apply for C-Test and Treat funding for the next year will be required to submit the following two documents: Prescreening Questionnaire and Program Grant Application. As C-Test and Treat continues to expand, we look to repeat programs to become more self-sustaining and actively pursue other sources of funding in addition to securing in-kind donations in the areas of refreshments, food, supplies, promotion, and publicity. The application process begins with the Prescreening Questionnaire. This brief query helps prospective host sites determine if they can, at a high level, meet and manage the core requirements to host a C-Test and Treat program. Here is an example of the C-Test and Treat Prescreening Questionnaire. The CAP Foundation offers grants of up to $20,000 to support C-Test and Treat program expenses that other grants and in-kind donations do not cover. Items eligible for grant funding include medical equipment, transporting or renting equipment to perform breast and cervical cancer screening, laboratory support staff necessary to perform the screenings and tests during the program, testing and screening supplies necessary to perform a breast exam, screening mammogram, fine needle aspiration, pelvic exam, Pap testing, HPV testing, colposcopy, and LEAP. Temporary program coordinator to plan and coordinate program logistics. Marketing and promotion, promotional activities, tactics, and materials such as posters and flyers to reach your target patient population. Translated promotional and educational materials. Interpreters. Patient transportation assistance. Bus tokens or cab vouchers to help patients get to and from your C-Test and Treat program. Supplies for children's activities, and a healthy breakfast and lunch for patients and volunteers. The next step is the program application. The C-Test and Treat program application asks a series of questions pertaining to your program's target population. Why is there a need for a C-Test and Treat program? What barriers to care are faced by this group? How will you reach out to your target audience? Tactics for promotion and marketing. What other screening services will your program offer, as needed by the population being served? Examples include bone density, dermatology screening, STD information, HPV vaccine, flu shot, housing information, etc. What screening guidelines are being followed? How will you connect women to care, whether it be prevention or those needed further cervical and breast cancer screenings? What funding is needed by your organization and why? Have you identified any sources of external funding to support your C-Test and Treat program? What community partners and volunteers will your program engage? The CAP Foundation requires submission of patient outcomes data and grant reconciliation information, including program patient outcomes data, such as patient demographic information, number of screenings performed, breakdown of results, and information regarding care plans for those presenting with abnormal results, whether it's a 6-month follow-up appointment or if the patient is scheduled for further diagnostic screenings or cancer treatment. Review the list of requested data with a member of your IT or IS area to determine in advance how this information will be extracted from your database and/or patient medical records. We ask host sites to provide as much detail as possible. This helps us tell the story of your C-Test and Treat program and its impact on your community. Approved C-Test and Treat program sites will receive 50% of their grant funding approximately 8 weeks before their scheduled program date, and the remaining 50% after receipt of C-Test and Treat program outcome data and grant reconciliation documentation outlining the actual costs of the funding items in order for the CAP Foundation to monitor the actual program costs. Please note that any unused funds must be returned to the CAP Foundation. I cannot stress enough that planning is the key to any successful event, especially C-Test and Treat. Before, during, and after your C-Test and Treat event, you are managing multiple moving parts: providers, patients, specimens, volunteers, results, and education. Mapping out your program flow is a beneficial group planning tool, first looking at each area independently and then as a whole. This exercise helps to identify needed resources, uncover any logistical issues and potential bottlenecks that may occur, which can be addressed prior to your C-Test and Treat program day. Here is an example of a process flow that outlines specific areas of patient movement. These swim lanes illustrate the patient check-in process, patient movement within and between the breast center and the OBGYN screening areas. This is an example of a patient scheduling grid, taking into consideration the time to complete on-site paperwork, cervical and mammography appointments, along with the anticipated time that the patient's Pap test results will be ready. This example process flow focuses on the movement of patients through the mammography screening areas. This example focuses on patient cervical screening. These are examples of other areas to map out that also support your C-Test and Treat program. C-Test and Treat connects communities with their healthcare providers. The program connects hospitals, clinics, clinicians, and volunteers with the communities they serve. Every C-Test and Treat program begins with a pathologist who recognizes the need in his or her community, champions the program, and rallies a host of partners to deliver patient care. Everyone who participates in a C-Test and Treat comes away with a greater understanding of the pathologist's role in community medicine. Patients learn who pathologists are, what they do, who to call for a second opinion. Residents gain experience engaging with patients and the public. Other clinicians see how pathologists can connect with their patients. Healthcare administrators see pathologists playing leadership roles. I would like to share with you this powerful quote from Dr. Eric Glassy, a past CAP Foundation board member, after he attended a C-Test and Treat program in California. His words truly reflect the collaborative nature and spirit of C-Test and Treat, connecting women to healthcare, as no woman in the U.S. should die of undiagnosed cervical or breast cancer. For questions or to obtain any further information, such as the Standard Operating Procedure Manual, please visit the CAP Foundation website at foundation.cap.org, Get Involved, C-Test and Treat, or contact me, Julia Rankenberg, at jrankin@cap.org, or via phone 847-832-7931. Thank you for your time today. I look forward to hearing from you soon.